The Nebraska Health Information Initiative, or eHI, is a statewide health information exchange. eHI was the first state that worked to integrate PDMP data into the HIE. Other states are beginning to follow suit as providers are resistant to logging into separate siloed systems to access PDMP data on controlled substances. eHI has worked diligently over the years with state senators and stakeholders to develop and implement a statewide health information exchange that has 68% of all hospital beds in Nebraska sharing data and more than 9,000 healthcare providers enrolled into the HIE. Legislation was passed in 2016 that mandated the reporting of all controlled substances to the PDMP, preventing consumers from opting out of the PDMP, and made the data in the system available to all prescribers and dispensers and their designees at no cost to them. On January 1st, 2018, all filled prescriptions will be reported to the Prescription Drug Monitoring Program, which will provide at no cost a medication reconciliation tool to prescribers and dispensers. Nebraska is embarking on an innovative approach to improving the medication reconciliation process for providers and hospitals. Medication reconciliation is the process of obtaining a patient's complete medication history of all medications the patient is taking and how they're taking those medications. Medication reconciliation doesn't happen one time, but is conducted throughout the patient's continuum of care. Nebraska is taking the lead by being the first state in the country to use the Prescription Drug Monitoring Program, or PDMP, to collect information from all prescription drugs dispensed and to report this information to the authorized users. The primary purpose of the PDMP is to help prevent the abuse and misuse of controlled substances such as opioids. By using and expanding this existing system and working with pharmacies and software vendors, Nebraska will be collecting information on all prescriptions that are dispensed beginning on January 1st, 2018. This will give healthcare providers a comprehensive medication history tool for those providers to make a better informed clinical decision for the care and treatment of their patients. Nebraska is leveraging the eHI infrastructure to give healthcare professionals access to the PDMP and the medication history at no cost.